They mean gender affirming care, period. So this
Yeah.
isn't about kids. This isn't about teenagers.
Yep.
This is about
You might be
a 65-year-old trans female.
Yeah.
Is
the provider that's providing the gender affirming care to that individual, who's got a right to their own body, who has a right to their own healthcare decisions. That provider will lose all funding from all federal sources with some of the dialogue that has been said, not once, not twice, but many times from who's now in power. It is a terrifying prospect. And it makes trans families feel incredibly vulnerable right now. Even just that vulnerability that they've been placed into, to be transparent, it makes me angry.
Welcome to the East Anchorage Book Club. I'm your host, Andrew Gray. The purpose of this podcast is to tell the stories of Alaskans of interest and importance. Today, our guest is the new Executive Director of Identity, Tom Pittman. Identity, Inc. was established in 1977 as the Alaskan Gay Community Center. Over the years, Identity has had different roles and purposes within the LGBTQIA2S+ community in Anchorage, but has always sought to provide a safe haven for every gender, identity, and expression. In 2021, Identity merged with Full Spectrum Health and became Identity Health Clinic. Tom Pittman has a master's in health administration from the University of Washington and has supported his tribe, the Tlingits, by working for the Southeast Alaska Regional Health Consortium. He worked as an administrator for Fairbanks Memorial Hospital throughout the COVID pandemic and its aftermath. He began his tenure as Executive Director of Identity in January 2024. Tom Pittman VIII, welcome to the podcast.
Thank you. Thank you.
Have you met any other eights?
I haven't met any. The only one I've heard of is Henry VIII.
Right.
Which I don't know. That's what I want to pattern myself after.
Yeah. So I guess let's start by talking a little bit about that. Talk about your family, your early life.
Yeah. So I was born in Juneau. My family's all from Alaska. I'm Tlingit. I adopted in Tom, which is a clan. Our ancestral lands is Glacier Bay. With the advance of the glacier, though, my clan doesn't live there anymore and mainly reside in Angoon and some other communities down south. My great-grandpa moved here with the USGS, and he's who I inherit my name through. So he worked for the Treadwell mine down there for a while.
He was the sixth?
He's Tom 5.
Tom 5.
Yeah.
Sorry.
Yeah, I know.
Bad at math.
So the interesting thing about it is my grandma's really into genealogy and she can't find the original Tom. So I might be Tom 7.
Oh.
But I don't know. Traditionally, though, because it's not legally kept that way, it's just within the family that it's been kept. And so traditionally, I'm Tom 8. Yeah.
Gotcha. Yeah. So your great-grandpa came to the mine.
Yeah. My family's been in the Juneau area for the longest. My grandparents are down there, aunts and uncles, cousins, and whatnot. I was born down in Juneau, and I lived there through most of my elementary school years, and then moved to Eagle River for middle school. And so I went to Gruning, and then went to Chugiak High. And Eagle River High actually opened my sophomore year. And so a lot of my friends were Chugiak zone, and so I stayed at Chugiak where I could stay with them. And then went down south for college. I studied health administration, and from there, my partner at that time was actually just got accepted into grad school in St. Louis, and so moved out to St. Louis for a while, worked in dentistry for a good little bit, and then I had the opportunity to move back home. So I moved to Juneau and worked for SEARHC. Mainly working with their dental teams, almost exclusively out in the village, which was my first time really being able to travel around Southeast Alaska outside of Juneau-Sitka. It was incredibly special for me, and I think really opened my eyes to the Alaskan experience outside of, on the scale of the other states. Juneau's not a big town, but here in Alaska, it's huge.
Right.
And yeah.
Talk a little bit about that. Like, what were some of the observations that you had as somebody who hadn't spent a lot of time in the village? What are some of the things that kind of leapt out at you?
Yeah. I appreciate that question a lot. That's, I think, the thing that I enjoyed most about that role that I got to have at SEARHC was being able to see an experience, especially the Native Alaskan experience that isn't in Juneau, Anchorage, Fairbanks, these other towns. The vulnerability is the thing that weighed most heavily on me. Just a handful of medical providers are who cares for everything for that community. That's a unique position that those providers decide to embrace, but it also is a unique relationship that community has to healthcare because those few people are their end all be all of everything. And it's not just that way with healthcare. It's education. It's everything. And so it makes it a very fragile situation. It means that the few people who are out there doing those things, educating, providing healthcare, doing these things, have an outsized impact on the well-being of that community. So that was, I think, that the first lesson that I learned is when you are out in the bush, when you're out in the villages, what you do really matters. What seems like a casual interaction in Juneau, the thousands of people that we serve there, is a whole different dynamic in those communities where the relationships are much more intimate and have much greater impact. One of my first trips I got to do when I was with SEARHC is actually to Pelican, Alaska, which had at that time 49 residents. I flew in a seaplane into that community, and I was asked to be on that trip specifically for this kind of education that it gives you, to be in those communities and to see its response. They have a part-time nurse practitioner every other week. The nurse practitioner is there. Otherwise, they don't have healthcare. I flew in with the dental team. We spent a week there, and the whole community in the course of a week comes through. Right. Yeah, it's such a different relationship. And again, the vulnerability. That dentist, they are the only dental care for that community. And so that dentist, that's a lot of weight on their shoulders. It's not where we live here, where we have a choice of providers and we can decide who's a good fit, who's not, who do we have confidence in, who do we not.
Pelican was in the news last week. Did you see that?
I didn't. No.
Yeah. Pelican was reported as having 0 votes for Mary Patola.
Oh, wow.
It was incorrect.
Oh,
People in Pelican knew that they had voted for Mary Patola.
I didn't know this.
And so they had to recount Pelican.
Really? Because people knew that they weren't being
They
represented.
absolutely knew that that was not accurate. And it stood out because for an entire
community,
small rural community, to have 0 votes for Mary Patola leapt off the page as being shocking.
I only spent a week there, but I would be shocked too. I would be very shocked too.
Yeah. They were recorded incorrectly.
Wow.
So, wow. Regarding that role at SEARHC, you were like the administrator for dental. Was that?
Yes. At first I had the Southern clinics from Prince of Wales and Pelican and all these communities down south, Sitka, south of Southeast Alaska is who I represented. And then later on my role shifted and I was supporting in some other ways, but primarily the whole entire time I'd be jumping on Alaska seaplanes and getting out into the bush. Spent very little time in Juneau itself, even though that's where I lived at that time. It was really special for me coming back home to Alaska to be back in Juneau. My extended family is very much involved in culture. My Aunt Katie teaches in an immersion school. I'm incredibly proud of their connections, but my family, we weren't incredibly connected to culture when I was growing up.
To Alaska Native culture.
To Alaska Native culture, exactly. Yeah, sorry. Thanks for clarifying. Yeah, so to Alaska Native culture, it wasn't a big part of our family. And so when I got to move back to Juneau, I felt like I finally got to build those connections and make it more a part of me. Before that, it felt like something whenever I engaged in culture, I felt like a fraud. I felt like even though it's my family, it's my people, I didn't feel Native enough. I didn't feel like it was something that I could claim ownership of. And it was living in Juneau again, especially at that time. This was starting in 2017, that I really, truly felt Native. And not just that I have Native ancestry, but that I am Native. And that I don't have to qualify that with a blood quantum or with these other
Did you identify as Alaska Native when you were in Eagle River and like going to high school?
I did. But again, it always felt like a veneer. It never really felt integral to me. In part because the intersectionality of being mixed meant that how other people perceive that shifts a lot of how I perceive it myself. And oftentimes whenever I mention that I'm Native, people would want to know how much. And that, I think, is a lot of what made it so that it felt like I had distance with that identity until I moved back to Juneau and got to really be around other Tlingit. And especially having been out in Missouri for so long, really helped me own it and let it be a part of me. Yeah, so that was also pretty early in my healthcare career too. It was at that time that I started my MHA, my Master's of Health Administration, through the University of Washington. They had a really wonderful program. Their executive MHA allowed me to stay in my community and to work in my community, but travel to Seattle once a month for classes, which was definitely expensive, but I was incredibly grateful for. That program in particular is really hands-on. You learn from people that work in healthcare. It's not just academics. And so it really helped me create a vision for what I wanted for my career focused in healthcare. Yeah, so I was traveling around all the villages and then traveling on the weekend down to Seattle. So I was not at home probably 80% of my week throughout that period. Which was definitely exhausting. It took its toll. But also, as we talked about with my time in the village, really shifted how I view healthcare and how vital it is and it can be, which ties a lot into my role at Identity. Even though Identity is here in the most metropolitan space of all of Alaska, in reality, for the 1,400 patients we serve, 890 of which are gender diverse, we are a lifeline like that. That intimate relationship and that a very personal dynamic, shares a lot with the experience that those in the village have. Or your providers are limited. The people that are going to be able to provide healthcare to what you need is narrow.
Before we talk about that, how do you identify?
Yeah. I'm most comfortable with the pronouns he, him. I identify as a gay man. I came out later in life. I came out while I was in grad school. So in the same time period when I was living in Juneau was when I came out. It was a hard journey for me. I was out to myself in my late teens, early 20s, but I had a really hard time owning that and feeling like it was something that I could be public about and not have it hurt me in any way. In part because I grew up in a very religious, conservative dynamic, high control religion dynamic. And so I think that was in part, but I think also I didn't have a lot of people in my life that were out. And my Uncle David was the only one, but he passed away when I was very young. And so I didn't have anyone in my life that helped show me that I can be me and be happy, be my full me, and not have it hurt me, but instead be something that I could really enjoy, something that I could really feel ownership of myself with.
So were you mid-20s when you came out?
Yeah. Yeah.
And how is your family with it today?
I have a very good relationship with most of my family, most of my immediate family. I have a pretty big family. I have 9 siblings and 8 siblings.
Are you the youngest?
No, I'm second oldest.
Gotcha.
Second oldest.
Yeah.
Oldest boy. So most of my family I have a very good relationship with. For the most part, my family were all, from the beginning, actually very supportive. It was an experience where it was mostly barriers that I had to overcome. It was things that I had to reconcile rather than my family.
Mm. Can you talk about being a gay man as a Tlingit?
Yeah. And that's interesting. So when I came out is also when I was really connecting with my culture. Those two things coincided. And I don't think that's an accident.
Coincidence.
Yeah, exactly. I think the one helped me explore the other and vice versa. Tlingit history is gender diverse. Our history is queer, and colonialism stamped a lot of that out. And one of the wonderful things about my tribe and my people is that I found connection and I found safety there. Many of my opportunities to be out were when I was out in the village, where I could talk with community members there after hours when I'd be at getting dinner, where I could connect with people and talk about who I am and not be afraid of it. So the two really coincided. It was a really liberating experience for myself. And then, of course, I was in grad school at the same time, too. So when I'd fly into Seattle and go to UW, it was the same experience there. It helped me really be comfortable being who I was. And then I could take that home with me.
Let's jump ahead to talking specifically about identity and what brought you back to Anchorage.
So between Juneau and identity, I actually worked for the hospital up in Fairbanks for a bit.
Okay.
So
Fairbanks
Memorial Hospital. Yep, exactly. Through the program at UW, I actually met Shelly Evanall, the CEO of the hospital up there. And she invited me up to help with some business development projects. This was pre-COVID, and COVID hit the hospital up there pretty hard. Financially, it did. And so my role shifted a lot after the COVID crisis started. But at first, I was really wonky, delving into some analytics of volumes and exploring services that we could open up in Fairbanks and bring services home rather than people having to travel out. That was a lot of fun. We brought in a new plastic surgeon to that community, brought in a new allergist, a lot of really fun projects, very different from what I'd done in the past, but really enjoyed. In total, I was responsible for 17 departments up there, and that was a big stretch for me at that time. That was a big leap forward in terms of the responsibility that was on my shoulders. And so I was carrying a lot at that time emotionally.
Were you with your partner then, or are you single?
That's when we met. When we met. Yeah. Yeah. So my partner, Chris, that's when we had met. He's a longtime resident of Wasilla. And so we would travel to see each other. I would travel here and he would travel up to Fairbanks about twice a month. One of us would go one direction. And then, of course, COVID hit. And Fairbanks at that time only had 2 public health nurses. And so the hospital bore a lot of responsibility for public health for the community there. And at that time, a lot of the specialty services needed to wind down. A lot of elective cases that were in our operating rooms had to be postponed. And most of my departments that I was responsible for were surgical. And it meant that a lot of my staff and a lot of my teams were needing to be repurposed. And the testing, a lot of those early operations were things that we delved into, my team and I, full bore. And that shifted. Again, I was brought up there for something very different than that. It was incredibly stressful. It was overwhelming, to say the least. I was already feeling pretty overwhelmed with just how much new scope I had in that role. But then with that COVID crisis, it definitely felt like a lot. Yeah. And so then at that time, it was hard for Chris and I too, because I was so busy there in Fairbanks. And then also, not understanding and knowing what would be safe for travel. And so the chances to see each other definitely diminished. So coming back here to Anchorage was a lot about being able to be together and to not have that kind of separation, which has been really wonderful. We just celebrated 4 years together, and only for the last 18 months have we actually been able to be together every day. So that has been really helpful and wonderful for me, especially with this journey that I'm on with identity. Because this last year has not been an easy one with identity. We can definitely delve into some of those dynamics. It's an organization, yeah.
Did you seek out the job at Identity, or did Identity seek you out?
I sought out Identity. I first joined the board of Identity and served as the secretary of the board for Identity for a good few months. So Identity has a long history. It started as a community center back in 77. And thinking about the Anchorage area back in 77, it's quite unique that we have a history that goes back that far nationwide, much less for Alaska. And so the journey for Identity, it was only up until 2021 that the mission of Identity shifted. We were a community center only throughout that period. There were times where they didn't have a building and they did have a building, times where collaborations with other organizations allowed Identity to have a physical space, but that history is deep. So in 2020, conversations first began of merging Full Spectrum Health into Identity. Full Spectrum was an organization that provided mental health services primarily, but also gender affirming care to the community, and very much aligned with the mission of Identity. So the board at that time, and this was prior to my involvement with Identity, made the decision to do that merger. It allowed Full Spectrum to really shift. It was set up originally as a for-profit business, even though it operated as if it wasn't, and that wouldn't ever be sustainable. And that benefited the community a lot in terms of access. We've been able to increase our access and our patient load significantly. We're now, like I'd mentioned before, serving 1,400 Alaskans now, whereas at that time it was significantly less. And so it was advantageous, but it significantly shifted the focus of Identity, for better and for worse. There are plenty of community members that are valid in saying that that meant that Identity never was what it once was. And there's definitely something to mourn with that.
I guess just to be really explicit about it, because I have heard from some of the old timers. They'll say things like, Identity is something completely different. Identity is now a health clinic. It's not a community center. And we don't have an LGBTQ community center because Identity is now providing healthcare. And I think
there's validity to that statement. And the way that those folks see that, I'd say they're not off. Like that's pretty accurate. And I definitely have more that I want to share on that in a minute here. But just our last board meeting a few weeks ago, we had a bit of an elder summit. And one of the programs of Identity is Alaska Rainbow Elders. Many of the individuals involved with that were the ones that ran Identity back in the day. They were the people that made those contributions. And it was really helpful because the board we have now has almost no overlap with who the board was prior to that decision. And so it was very helpful for us, I think, to hear those perspectives. One message that I'm very grateful to hear, though, is the needs of the community are significantly different than back then. A physical community center is still a very needed thing, but to hear our elders describe it, the way that it was used back then is different. And they started to see that use wane more and more. And one of the, I think, tongue-in-cheek things that was mentioned that has stuck with me was there was a lot of vocal people saying, we need a community center, and then they'd never be there. And that's a fun tongue-in-cheek thing. But I think it's also describing the different dynamics that the queer community has now. It's easier to find community and it's harder to find community.
So when I worked at the VA, we used Identity. The VA has some support groups. I guess what we felt was missing was the veteran support group at the VA was for veterans. So there wasn't really overlap with folks who were still in the military or in the Guard. And so we wanted to have a more inclusive group. And we also felt, because of the history of folks being dishonorably discharged for being gay, that they wouldn't have VA benefits. And although there have been some efforts to fix that, but we felt like we wanted everyone to feel like they could come, whether they were an official veteran or they had just had some history in the military, and also include folks who were still in. And so we met at Identity.
Really?
Yeah, we met on Saturdays. I would say when we started off, we had eight or nine people. COVID killed it.
Yeah.
Like basically what happened is it didn't really translate to a virtual meeting.
Yeah. That decision that the board made at that time to merge and become a healthcare entity happened at the same time as COVID.
But I was also going to point out,
Yeah.
it felt like no one was using the facility. It
Yeah.
felt like
Yeah.
that we were doing this 1 hour meeting once a month on Saturdays. And granted, I wasn't showing up at the center on random weekdays or whatever, but it felt very underutilized. It felt like a quite large space that wasn't getting its money's worth, so to speak.
Yeah. And I think that was seen too by the board at that time too. And looking at the community and where the needs were, this is critical. There's some really wonderful providers out there that understand the needs of the queer community, have spent the time to develop the cultural competence to provide healthcare for us, whether it's primary care, behavioral health, affirming care, whatever it might be. But it's very different when the whole organization centers the needing queer person. When a patient comes to Identity, they don't have to worry if the front desk person holds an opinion about them that dehumanizes them, or that a policy decision made by Identity is going to be centered on the needs of someone else rather than what their needs might be. That's quite unique. And the board at that time, engaging with those folks, they understood that need. They understood that this was a way that Identity could leverage its resources to benefit Alaskans the most. But it did fundamentally shift Identity. And all these changes happened at the same time as COVID. And so a lot of the programs at Identity had to go virtual, and it shifted so much of the engagement, and almost permanently, because the focus, healthcare's a beast. And so the focus at Identity, it just gobbled up all the air in the room trying to operate a clinic. And that's a lot of what pulled me into the board too, is moving back home to Alaska, to my home where I grew up. I wanted to be involved in the queer community, and I wanted to do it in a way that felt authentic to the things that I could bring to the community. With my background in health administration, I joined the board. I did not intend it ever to become the executive director of Identity. However, the work that I was doing on the board more and more was leaning into the operations. And eventually the board decided, they had gone a long time without an executive director, decided to try and recruit an executive director. The first pass, I remained on the board, and I didn't put my name in the hat at all for that role. Because again, my intent wasn't to jump into this role. But when that didn't yield the results that the board was looking for, I resigned the board at that time and put my name in the hat. And thankfully, the board decided to bring me on as executive director. So that was back in the fall of 2023. And so I stepped into this role early 2024. In January was my first month as executive director with Identity. And so at that point, Identity still had some programs up and running. We had a Q Club, which we still have today, which is online. It's a virtual space for youth, and a handful of other really important programs. We have a support group for parents that have a gender diverse child. It's called Transparent. We have a handful of other really important resources. I had mentioned ARE, Alaska Rainbow Elders. However, really the focus has been healthcare. And so this is something that Identity has recently embraced, is that we are a healthcare organization. We support community organizing. We support community events, but that's not what the community needs out of Identity anymore. This is something that we only in our most recent board meeting fully embraced and had a resolution to adopt Identity being a healthcare organization. It's where the need's greatest. Identity has never once had to recruit a provider, has never once had to advertise to get a patient. And that's because the need is so strong. For a queer person interacting with their primary care provider, their behavioral health providers, with their sexual health needs, there are really wonderful providers out there that do that. But like I said before, when the whole system is designed around your needs, when you don't have to question, why did they deny me PrEP? Is it because it was actually the right healthcare decision for me? Or is it because of some other worry that I have to have that I'm not equipped with the knowledge because I'm not a provider to navigate? I have to trust them, but can I trust them? That is a different equation than identity. And the need has been so strong that if anything, there's been a wait list that has been beyond what I think in good conscience identity would be able to carry. We've been undergoing an expansion. You've helped us try and gather resources.
I did. I failed.
Yeah. No, you, I think, helped me with some positive connections and helped me shift the way that I think about it.
I think part of it was because it was in the middle of campaign season.
Yeah.
And I think some of those donors were really looking at making their big donations to campaigns.
Totally.
And so I think
Your network,
the
that's where that
timing
is.
Yeah. So I reached out to a network in Washington State saying, would you be interested in helping launch this expansion? And they basically were like, that's not really our thing.
Yeah.
And I was like, yeah, I know it's not your thing. I'm asking you to think differently.
Yeah. But it helped me shift my thinking too on how we can engage with major donors and try and piece things together to finish out this expansion. My background, I'm a health administrator.
Right.
Like that world is so foreign to me. So we've been stalled on this expansion for the longest. We started the expansion just prior to me joining Identity. And then our contractor has been incredibly patient with us because we ran out of funding and we had to sort through that. Thankfully, we're mostly through the woods now on this expansion. What this expansion will do is it'll let us go from a capacity of 1,000 patients to 3,000, which is significant. It's huge. Right now, we're serving 1,400 patients, but any one of those patients that you ask will share with you that things are cramped.
Right. I did a trans series back in
April. I listened to a lot of it.
Yeah. And we had somebody who said that they had called Identity and that no one called them back, and that they had called Identity and it was going to be forever. And it was just like a very difficult process to get established.
Yeah. And that's very accurate. That's very accurate. Part of it is we had to shift a lot of how we do things. So I can't chalk it all up to capacity issues. A lot of it was healthcare is complex and healthcare operations is very complex. It's not an accident that it evolved that way. And we won't delve too far down that rabbit hole.
Right.
But
I'm doing a series. It's so funny because I hadn't really thought about your interview as being a part of that series, but I'm doing a series on healthcare in Alaska with the goal for me as a legislator to learn how to lower the cost of healthcare in Alaska while improving outcomes, which I think is something that lots of people have talked about for a very long time. I feel like it's like a beaten dead horse that people dropped for a while.
Yeah.
So I'm
especially with COVID.
Yeah.
Especially
so
that crisis.
I'm trying to go back to it. And so I think this is an interesting prospect of starting a new clinic. Would you see Identity if the expansion happened, the 3,000 patients being spread out across the whole state, or would it still be a Anchorage-Matsu-based clinic?
Yeah. So 20% of our patients currently don't reside in South Central Alaska. 20% of our patients are down in Southeast, out in Bethel, up in Fairbanks, in other parts of the state. So we are a South Central clinic. We don't want to be, but we are. In part, that's because of, again, with access to care being so hard, it's just been that those that are here have gotten in the door faster. And so part of it is that Identity has needed to shift how accessible we can be around the state. With our expansion to 3,000 patients, that's for 3,000 in-person patients. And so that will be South Central Alaska. That's where that'll mainly impact. That said, half of our providers are virtual. And so we are very capable of increasing and expanding statewide. Part of that is that we need to organize at least annual trips out to other communities. That way we can at least have one in-person visit if we're going to be managing any kind of controlled substance or med management that gets complex. And so like testosterone, precisely. Yeah. And Identity has had a really hard time having the resources to do those kinds of things. And so most of our patients that are in the rest of the state are coming to us for behavioral health. Behavioral health access is, I don't have to tell you, is incredibly hard. It is incredibly hard to find a competent provider of mental health that can truly help from where you're at. And especially for someone that's queer, someone that can see you and help you from where you're at. And so that's primarily the services that we're offering the rest of the state right now. It's not that our doors are closed on the other services. It's just Identity hasn't had the resources to send a provider out to those communities once a year or however frequently. In part because this expansion has just been a financial weight on Identity. Like I said, we're almost through the woods, but things have been tight. This last year has been incredibly hard. So we finished 2023 by $173,000 in the hole. For an organization of our size, that's massive. And delving deeper into the members, the causes of that were we were able to make up a good chunk of that with grants. The clinic itself was draining a lot of money. And so the work this year has been to shift that. We're now 80% funded by patient revenue, which has been a huge climb for us. We've also had to shrink. When I first started, we had 19 staff. Now we're down to 11.
Yeah, I was reading some articles from about 7 years ago in the ADN, and one was a profile of a doctor who created a micro clinic.
Yeah.
She downsized her staff to 0.
Wow.
She checked her patients in.
Wow.
She did their vitals.
Wow.
She did the entire visit and did the note. And basically was renting a very small space.
Yeah.
And at a certain point, she was just like, I can't make a living off what I'm able to charge as a primary care and pay for a front desk person and pay for an MA to be doing the vitals and you know, getting things started. Like, honestly, just I've got to be all those people.
Yeah. Unfortunately, that is a lot of the economics of it. And that isn't unique to Alaska. It's just worse here. Nationwide, that's one of the reasons why there is such a shortage of primary care, is because the economics of it. It doesn't reimburse by Medicaid, Medicare, Blue Cross Blue Shield, the other third-party payers, to an extent that it's a viable business, especially if you're heavy in the government payers and Medicaid, Medicare.
Right.
Identity doesn't close our doors to Medicaid, Medicare. We have no cap or no limit. And so about 70% of our patient base rely on that to foot in the...
And I think the thing to say as a legislator looking at the cost of healthcare and knowing that we have some of the highest healthcare costs in the world, pouring more money into the system. In other words, having Medicaid and Medicare pay more actually increases costs. We're already at the top. And what we feel is this constant pressure to throw more money. And so it's what I would say is that from my vantage point, primary care is not the place to be balancing the budget of our healthcare system. We've got some serious problems. It's not in the primary care zone. So it's one of those things that I wish there was a way to somehow leverage bringing down costs in what are basically monopoly specialty practices in the state of Alaska that are able to charge 10 times what would be charged in Washington state. That's where we've got to...
The kinds of services that are at the surgery centers, like that's the area where the costs just skyrocket. And it's not groundbreaking to say that. Anyone that works in healthcare in Alaska knows this. Anyone that works in healthcare here knows this. It's at the primary care end that we're squeezed, and it's at the specialty end, especially in those more narrow
you have
specialties.
Nowhere else to send them. And they've got enormous practices. They can see your patients.
And they can go to the insurer and ask for
whatever it is, and the insurance can't say no because the insurance has nowhere else to send them. Although we have seen models where insurance companies are willing to pay to fly people out because there is a cost savings in flying them.
And that can be good, but oftentimes it also isn't. Getting care outside of Alaska isn't the ideal either. Being able to provide services here where your family is, where your resources are, where, if you are doing that surgery, where you can recover with that network around you.
Bouncing back to talking specifically about identity and the fact, I forget the percentage that you said is getting gender affirming care.
890 of our 1,400 patients.
So more.
Sorry, those aren't the individuals getting gender affirming care. Those are gender diverse patients.
Roger. So they might just be getting mental health.
They might be. So they might be coming to us for sexual health, for primary care.
Gotcha.
Yep.
So a couple of things. Number one, I worked at the Alaska VA. We did provide gender affirming care. I would say that figuring that out, if you were a gender diverse individual arriving in Alaska and starting to set up your care at the Alaska VA, there are plenty of providers that wouldn't have been comfortable with that and not necessarily would have known how to send you down the hall to the correct place. So it could have been an uncomfortable experience. But I just want to say the VA system as a whole has gender affirming care, has a very simple to follow rubric. Theoretically, any primary care provider.
Fantastic providers. Really fantastic providers
Truth.
that are doing that.
Yes, truth. But also, I just want to say, those providers that don't feel comfortable with it, the rubric is so simple. If you're not providing it, it's because you're making a choice not to do this. It's not because it's too complicated. It's not because it's too difficult. It's because you don't want to take the time to figure it out. It's literally not that hard to provide that care, that basic care. There could be some complicated patient here or there that needs more.
But that's always the case with any kind of treatment, right? And It's not that these are new methods. These are incredibly well researched. They're practiced broadly across the United States.
And there's a long history of it. But I want to also just express a moment, like my own personal experience as a gay man who's a healthcare provider, having had some very awkward interactions with new primary carers when I've moved someplace and gone in and they find out that I'm gay. And I have felt like that there have been decisions made that weren't really best practices. I've sensed the discomfort from the provider. I've sensed them thinking like, oh, clearly you're going to always need an HIV test, or these sort of like assumptions that kind of come out that I'm like, no, you need to talk to me a little bit more about that. Like,
don't pay it with such a broad brush. Yeah. No, completely. And again, that's one of the major needs that identity fills, is exactly that. It puts a lot of onus on the patient to do the research to find out who's even going to see me as a human. Who am I going to have to invest that time in to educate my provider versus where can I go and just truly be cared for, taken care of, versus having to take care of my healthcare providers.
That said, I'm just curious, does Anchorage Neighborhood Health, are they LGBTQ friendly?
Incredibly.
So that's what I was thinking. I was thinking like there are systems available to folks that where they could get the care that they need.
Very much. And we are here to support them in doing that. Identity is not here to try and replace. Exactly. The needs of our community are so vast that we need every organization becoming competent in caring for queer individuals in all the different healthcare settings. And Identity is here to partner with other organizations to do that, has done that in the past and will continue to do that. Even though our focus is on healthcare, that is one of the areas of community support that Identity will always remain committed to, is being there for other healthcare organizations or other employers to help support the wellness of their queer staff or patients.
Getting down to like the brass tacks of Identity going forward, you have a model where you like to expand to 3,000 patients. I assume that you like to keep your doors open to Medicare or Medicaid patients, that you like to be able to service anybody who comes to the door, regardless of their ability to pay. How do you make a clinic like that work?
It's been hard this year. I felt very confident, though, that Identity has been on a trajectory where it becomes stable to do this in perpetuity. However, with the most recent developments at the federal level from this election, we are incredibly nervous about...
Because you're getting federal money right now.
70% of our patient base is Medicaid, Medicare.
Gotcha.
And so if direction comes from the executive branch that any organization that serves the needs of queer people will lose funding for those services, it's an unconscionable...
It won't cover.
And we have to take them at their word. Some of the things that have been mentioned is anyone providing affirming care will not be able to take any federal dollars. And so if we are taking care of our trans patients, we won't be able to take any money from Medicaid, Medicare.
So you would lose that. You wouldn't be able to provide primary care.
You wouldn't be able to come to us for primary care if you were relying on Medicaid.
Yeah, even though you're not gender diverse, it's because you're taking care of one gender diverse person, you're not allowed to accept Medicare or Medicaid for any other patients.
Precisely. And so think about Anchorage Neighborhood Health, right? Think about South Central Foundation. Think about these other healthcare providers and the trans patients that are going to them. The intelligent thing for those boards and for the leadership of those organizations to do is to think about the many and at the consequence of the few.
So it would basically be saying, like, the VA would stop providing gender-affirming care.
It would have to, if that's what the executive branch says. And that has been some of the dialogue from the executive branch, and we have to take them at their word. And so that, honestly, this last week, that has been almost daily. Identity has been talking through what that dynamic will look like, because Identity can't close our doors. We will always be open to our full community, to the full queer community. That's why we're here, right? However, if that unconscionable decision is made, how is Identity going to stay afloat? How can we continue to serve anyone without that funding? It's going to be very tricky. While this last year was incredibly challenging to get our finances right, that shaky foundation we built, we got to somehow figure out a way to make it adaptable to if that kind of thing happens. And you wouldn't have ever thought that could ever be something that would come from CMS.
And
but
it's
on the table.
They mean gender affirming care, period. So this isn't about kids. This isn't about teenagers. This is about,
you might be a
65-year-old trans female is if
The
you're
provider that's providing the gender affirming care to that individual, who's got a right to their own body, who has a right to their own healthcare decisions, that provider will lose all funding from all federal sources with some of the dialogue that has been said, not once, not twice, but many times from who's now in power. It is a terrifying prospect. And it makes trans families feel incredibly vulnerable right now. Even just that vulnerability that they've been placed into, to be transparent, it makes me angry. My family, my chosen family, are both gender diverse, and the conversations that they're having to have right now about how they're going to take care of themselves with what's on the table, it's something that no one should have to contemplate. When parents are thinking through this now for their children.
Hey, I got to get back into the weeds one more time.
Yeah, please.
So let's say, for example, the person has private insurance and their private insurance would pay for their gender affirming care.
Yeah.
Can the provider take care of somebody with private insurance and provide gender affirming care?
Yeah.
And still be able to accept Medicaid and Medicare for other people?
We don't know how this will actually play out. There's concepts of plans, right?
Yeah.
So we don't know how this is actually going to come together, and hopefully it doesn't at all. But identity has to think through this, regardless of how it might play out. And our policy from the get-go has been, no matter who you are, you can come to us for care. And it might be that a privately insured individual receiving affirming care from identity that wouldn't jeopardize. But at the end of the day, there are people without that insurance who still need that care, who need to go somewhere. And what are their options going to be? Identity has to be one of those options. And so we are currently wrestling through that. That's one of the reasons why this week has been so crazy is trying to think through how identity will navigate, but it will. We will. We've made it through hard chapters as a community. We've made it through hard chapters. Well, identity has too.
Initially, when we started starting up the conversation, do we need, if Anchorage Neighborhood Health is providing this, if the VA is providing this, if we've got these large organizations that are providing basically the gold standard care to the community, do we really need a clinic that just does this? Thank goodness you guys have been making these efforts, because if this happens, then it sounds like those other organizations will think about the many by necessity. And then folks would have to go to identity. They'd have to go to an organization that has its mission to provide this care no matter what.
Yeah. I appreciate you saying that, because that's very much how we feel too. What we do, our mission, is because that lifeline can't ever be severed. That has to be something that Alaskans have access to. The reality, I mean, if you've been following the Trevor Project, they just released their numbers. Calls to their suicide assistance line, support line, have gone up 700% in the last week, right? The reality is this rhetoric and these decisions made by those people has real impacts, right? Ever since that, referrals and requests for appointments at identity have also skyrocketed. All sorts of people that either couldn't afford to transition or for other life reasons were not taking those steps yet are now in a panic and feeling a need to go through that now. This is a lifeline that the community can't go without, right? For all the other reasons why I said that identity provides value to the community, whether it's that we're centering our decisions around queer folk, or whether it's that you don't have to ever worry about educating your provider when you're coming to identity, or if you're new to the community, you don't have to rely on word of mouth on who is going to be good for you. You don't have to try and pick that one provider out of this system of 100 providers that's going to understand you. At identity, everyone does, right? Those are all very real reasons, but this lifeline, especially in the new climate that we've been introduced to this week, it does. It makes it incredibly vital that identity can make its way through this. I'm confident that we will, but it's not going to be easy. It really won't. And what I really wish is that identity was heading into this with more stability. It has been every effort to just keep our doors open this last year. I probably shouldn't go into too many of those details, but at the end of the day, in order to keep our doors open, there's been a lot of sacrifice on behalf of folks that are at identity. We will be here throughout this, but it's going to be because the community rallies behind us, and that's what we really need, is for the community to recognize how important that is. One of the reasons why we're holding the gala.
If somebody listening right now is like, hey, I want to support identity, how can they do that?
There's a handful of ways. One of the very most meaningful, we talked about this financial turnaround that identity's gone through. The support of our community has been a huge factor in that. There's been individuals and organizations that have really come through for us. So first and foremost, anyone that is able to give, that wants to support the kind of work that Identity does, that is incredibly meaningful. One of the most inspiring instances of that, actually, there's an individual that has consistently given between $30 and $50 every month for the past 20 years to Identity. Their cumulative gifts are insane. And just by a small amount every month, if that's what someone's able to do, it's dependable monthly income that Identity can rely on.
Where do they go to make a donation?
So if you go to identityinc.org/donate, that's one way. You can also go to any of our socials. There's links there to donate. Or you can come to the Denina this weekend.
Yes, so we're having a gala this weekend.
We're having a gala this weekend. And that is another wonderful way to contribute to. Every single dime of that is going towards our expansion. So that way we can serve the amount of patients that we need to. We can decrease our wait list.
What time is the gala, and do people need to buy a ticket?
It is ticketed. Ticket sales are still open, though. Okay. And so tickets are available and will be available all the way through the 15th. So it'll be on the 16th.
Saturday the 16th. Mm-hmm. What time?
Dinner and the show all start at 7.
Okay.
For those that have purchased a ticket that lets them into the VIP cocktail hour prior, that starts at 6.
Okay.
And it's going to be an amazing time. Emma Hill is going to perform. Golden Delicious is our host. So there's going to be some really wonderful people there to make sure that it is a good time. The food's going to be fantastic. So outside of the fact that financially it'll do a lot for Identity to have folks there, it's also just going to be a wonderful time to get together as a community.
And they can buy tickets at identity.org?
Yes. Yep. Okay. At that same web address, identityinc.org.
Okay.
Through that link, you can get tickets to the gala, or you can just make a donation, or you can sign up for a monthly donation to Identity as well. That's just one way, though, to contribute to Identity. We wouldn't have made it through this last year if it wasn't for some of our volunteers as well. If you have a skill set that can support Identity's communications, our website management, our social media management, or even you just have the availability to be at a table, so that way we can be out there in the community. All of those ways are also really valued ways to contribute.
Tom Pittman VIII, thank you so much for being on the show today.
Thank you. I appreciate it a lot, Andrew. This has been really fun talking to you.
Thank you, listeners. If you like what you heard, please subscribe, rate, and review us. To contact me, email rep.andrew.gray@akleg.gov or call 907-269-0123.